How does autism affect students' ability to learn in the classroom and in everyday life? What is autism? Autism spectrum disorder and autism are both general terms for a group of complex disorders of brain development. These disorders are characterized in varying degrees by difficulties in social interaction, verbal and nonverbal communication, and repetitive behaviors. Autism usually emerges between the ages of 2 and 3. It can cause a variety of disabilities and problems for these children, such as intellectual disabilities, for instance, lack of attention and focus, sensory processing issues, repetitive behavior, and restricted interests. It can also cause difficulty in motor coordination and physical health issues. Some students with autism excel in music, math, art, or visual skills. How common is autism? Around 1 in 68 American children are on the autism spectrum. Of all the children ages 3 to 12 in the United States, 1% are on the autism spectrum. Autism costs an average of $60,000 a year per family. Boys are 5 times more likely than girls to have autism. And autism is the fastest growing serious developmental patterns. Children with autism follow different developmental patterns and develop at different rates. For example, a child with autism may start to use a few single words around 12 months of age. However, they may only learn a few new words each month, and it may take a child until 3 years of age to use short phrases. Children with autism also find it hard to recognize facial expressions and the emotions behind them, understand and control their emotions, and use emotional expressions. They tend to have trouble describing their feelings, and a lot of times say they do not have any emotion at all. They focus more on the mouth than the eyes of others and are not able to read people's emotions as well. They also face challenges in understanding others' interaction and communication. Attention and interaction. Children with autism lack social skills. They tend to use what is called joint attention or shared attention, which is a key skill that is needed for developing communication and language skills. It teaches children how to take turns, keep on topic, and interpret facial expressions. An example of joint attention is when a child and his or her dad are reading a book together. He or she may point to a picture in a book and then look back at his or her dad to show him the picture. Children with autism may also not respond to his or her name, make eye contact, smile, or use gestures. They find it hard to understand other people's perspectives and lack what is called theory of mind. Theory of mind is the theory of how most humans understand that another person has different desires and feelings. Children with autism find it hard to predict and understand other people's behavior and how their behavior affects others. Children with autism are also unable to see what is called the big picture because they are often distracted by detail and are unable to see the situation as a whole. Fitting into regular schooling. Children with autism a lot of times find it difficult to fit into regular schooling, so it's the jobs of parents and teachers to help them fit into regular schooling. Building familiarity is one way to help students with autism fit into regular schooling. Slowly introducing the things he or she will need for school will help decrease anxiety. And driving past school will help it become a part of their everyday routine. Making transition plans. Parents should talk to the teacher to let them know about their transition plans and what they will be facing once the student begins classes. Practice getting ready for school by following a visual timeline, and organization will help the student fit into a regular school. I interviewed a teacher of mine that teaches kindergarten at my elementary and middle school. I asked her this question: do you think children with autism or other types of learning disabilities should be put in special schools? Why or why not? She said, I think that the term special schools has an unwarranted negative connotation to it. Being a petite person myself, I have to shop in various stores that have a clothing line that is best suited for me. Is that a bad thing? No, not really. It is just something I do to make sure that my clothes fit me properly. Much the same can be said about children with various disabilities. There are some schools that are just better suited, equipped with bright staff, and have an appropriate facility, and are just better learning environments for those learners. I also asked her, if you have had to teach students with autism or other types of learning disabilities, did you have to teach them differently than the other students? She said in response, I Every student, every group of students is always different, and the need and demand for vary as much as the personalities of each student. The key is to know what the diagnosis is and discover a way to best meet their needs. After learning about autism and its effects on students' ability to learn inside the classroom and outside the classroom, people should be aware of what autism is and its effects on children, especially when it comes to learning. It's teachers and parents' jobs and responsibility to determine ways to help children who are diagnosed with autism to be able to learn and be just as successful in life as everyone else. Having autism should not limit children to the things they can do in life, which is why we need to become more aware of the ways we can help them learn and gain knowledge.